to Tea with T Cells. This is Marta.
I am Shafka. Tea with T Cells.
Green tea doesn't just contain caffeine, it also contains L-theanine, an amino acid that can promote relaxation and focus. Together, caffeine and L-theanine may improve attention and cognitive performance without the jittery feeling often associated with caffeine alone. Hello! Today we are joined by Dr. Charles Romanowski, Emeritus Consultant Neuroradiologist and Honorary Clinical Senior Lecturer at Sheffield Teaching Hospitals NHS Foundation Trust. Charles has had a fascinating career spanning anatomy, medicine, neuroradiology, research, teaching, international collaborations, and mentoring. But beyond science, he also has interests including Polish culture, music, hiking, photography, and having experienced it myself, a rather impressive collection of animals. Welcome, Charles.
Marta, thank you very much for the invitation. Thank you for giving me this opportunity.
Thank you for joining us today. A lot of things in your CV that we want to talk about today, but just to start, if you were thinking about the person that you used to be at the university, if somebody from your degree met you today, would they recognize the person sitting here with us, or have you changed, do you think, a lot?
No, I thought about this question. And actually, I think they would recognise me. I'd always had a focus. I think many of my colleagues at medical school knew that I was probably going to go on to be something. Perhaps I didn't believe it entirely myself, but that seemed to be the case. So, yeah, I think they probably would.
They would. Okay.
So did you do your medical degree first? So you did a career in medicine and then got into sort of research. Is that right?
Well, the career path begins obviously with medicine. Mm-hmm. So I did my degree in medical training at the University of Manchester.
Yeah.
As part of that degree, I took a break out of medicine for 1 year to do an intercalated degree in anatomy. It just happened to be neuroanatomy. Mm-hmm. And that was a great foundation as to what I was going to then do for the rest of my career. So I ended up doing 6 years at university and then qualifying as a medical doctor and then going through the usual training of house jobs and at the time were SHO and registrar jobs, etc. But I realised fairly early on after I qualified that radiology was going to be the specialty that I'd like to do. And so we focused on that from a relatively early career point of view.
That's really interesting because just the previous guest that we spoke to, he kind of had a bit of a reverse direction in life. So he started off his career doing a science degree and then going into research and then switching to medicine. I mean, I guess you never switched. You kind of did them both together. But yeah, that's really interesting that you can have multiple angles of approaching the same problem, essentially.
Yes.
Exactly. There is no right or wrong. It's whatever works for you. But let's start from slightly earlier time. Obviously, you are very interested in neurophysiology, neuroanatomy, neuroimaging. Do you remember the first time you developed this interest? What was the thing that actually started these thoughts about medicine, science?
It's one of those questions I have always asked myself. Why medicine? And actually, it's a very difficult question to answer. I'd always had a fascination for the human body. In fact, I think when I was probably the age of 7, I had a Ladybird book on the human body. Even from a very early stage, I always knew that I wanted to be a doctor. I probably didn't know why I wanted to be a doctor, but I knew that's what I wanted to do. And all of my focus, certainly latterly at school, doing A-levels, etc., was to get the appropriate grades to be able to get into medical school. And I was very fortunate to have some good teachers at school that helped me focus on getting to medical school. Anatomy, I suppose, in my naivety at the time, I thought maybe I'd like to become a surgeon. You know, you have all these glamorous aspects of medicine, and you know the surgery seemed to be a wonderful thing. And
my wife would love to hear you say that because she is a surgeon, and just like all other surgeons, she thinks it's glamorous.
Yeah, absolutely. She's not a neurosurgeon, is she?
No, she's not. No, she's a vascular surgeon.
Anyway, so I had an opportunity during the medical training to take a break. And this is something that is very interesting. It's actually sponsored by the Medical Research Council, or certainly it was at the time. And it enabled me to have a break in the medical training to take a year out and to do a BSc. I chose to do BSc in anatomy. And we had a very forward-looking professor of anatomy who said, look, you're being sponsored by the Medical Research Council. Therefore, you do research. And so there were 3 of us who were doing anatomy as an intercalated degree, and we were all given various projects that we could choose from, and basically we would focus on one project for the duration of the year, so almost more like an MSc than a BSc.
Right.
And I had been fascinated in the brain. Who isn't fascinated by the human brain? And also we had a very inspirational lecturer in neuroanatomy in my second year, and he was offering a 1-year project, and that was the one I chose. And well, you could say, the rest is history. But I think what's interesting as well, I came into medicine really with a lot of naivety. A lot of people come in with parents who have done medicine, but my parents hadn't done medicine. I came very much from a working class background in Manchester. So, as I say, I came in without really much knowledge, and most of the people that I'd met during the first couple of years were all medics. But working in the lab with Professor Alan Crossman, he was a pharmacologist, and then there was also a psychologist who was working in the lab who'd got into neuroanatomy and neurophysiology during his PhD. So suddenly I was immersed in the company for a whole year of, dare I say it, proper scientists, as opposed to doctors, medical doctors. And that, I think, was a great eye-opener as well. It made me appreciate that actually there are a lot of very, very skilled people in the sciences associated with medicine. In fact, maybe something I hadn't mentioned, but I actually had funding to go and do a PhD to continue, but so then it would have meant...
Was this at the end of your intercalated?
At the end of the intercalated degree, but I decided not to take that up because it would have meant then 9 years at university, which would have been a bit excessive. And I'm glad I didn't, because if I'd have done that, I wouldn't have met my wife, Sarah. So there we go.
So did you, I'm really curious because I feel like intercalated degrees these days sound like they're quite different from what you did. So did you spend like a full year in the lab?
I spent a full year in the lab doing a very specific research project on a very, very small part of the brain. And probably for one brief moment in history, I probably knew more about this part of the brain than anybody else in the world. But it introduced me to scientific study, scientific discipline.
Yeah. That's fantastic, because I feel like a lot of medics who do these intercalated degrees now, they just do a year, like a final year of a BSc degree, which I think they find probably less useful than doing what you did.
That was the case with many of the others. So, for example, the intercalated students, even in my day, that were doing, for example, biochemistry or physiology, they just joined the final year of that particular BSc degree course. And they made a part of that, had a small research project. But as I say, it was a professor of anatomy at the time, somebody called Professor Harris, who basically took the attitude, we're being funded by the Medical Research Council, therefore let's do some research.
That sounds
fantastic.
Yeah.
So very, very forward thinking, I think.
So do you think that this experience was the first one when you actually got more interested into neuroanatomy?
Oh, absolutely. I mean, and also neurosciences. The lab that I worked in was also heavily involved in trying to understand not just the anatomy, but the physiology of the brain, and in particular the mechanisms involved with certain disease processes, Parkinson's disease. So this actually comes full circle to something that I picked up later in my career. So whilst I wasn't involved directly in that particular aspect, I was exposed to that aspect and also exposed to some of the neurologists who came into the lab to help with some of the research.
So would you recommend nowadays to do research as a medical student? Do you think that it's something that made you look at medicine in a different way, in a better way, perhaps? Or would you say that it's optional and perhaps not for everyone?
And I guess tagged on to that, would you say it helped you in your career, or would you maybe have picked it up later on if you hadn't done it at that stage?
No, I absolutely. It was the keystone to my development in my career as a neuroradiologist. It was the introduction to the more detailed anatomy of the brain, but also diseases affecting the brain. And I went on, I suppose, through the rest of my medical training, thinking perhaps as a medical student I might like to be a neurologist, or for one moment I even thought about being a neurosurgeon, but very rapidly decided that wasn't the route for me. But as a result of that particular interest, I chose my first jobs as a newly qualified doctor to include a job on the neurology ward. And interesting, I think this is, I don't want to preempt too many questions, but when I was a house officer on the neurology ward, thinking I want to be a neurologist, it did two things. It first of all made me realise I did not want to be a neurologist.
Similarly important.
Very important. But also what it did as a house officer, one of my responsibilities was to go down to the neuroradiology department with a little request card to request either a CT scan or an angiogram or a myelogram. And it was that physical walking down into the department, meeting the neuroradiologists, and we had two very keen neuroradiology trainees in the department in Manchester who inspired me and made me think, actually, you know what? Neuroradiology, that's going to be an interesting career. So yeah, sometimes the negative, no, I don't want to do that, is just as important as the very positives. Yes, I do want to do that.
That's fascinating.
So what is then neuroradiology for those that haven't?
Okay, so neuroradiology is basically the medical specialty that involves the interpretation, the medical interpretation of images of the brain. So many people are familiar with the techniques of CT scanning, MRI scanning, etc. And these are wonderful techniques that show the anatomy of the brain beautifully and also show the pathological processes that go on. As a qualified doctor, medically qualified doctor, what I do is I provide the medical interpretation of those images. So I would provide a report to the either neurologists or neurosurgeons or other hospital doctors or GPs even on what the imaging showed. So in many ways, I was very key to the diagnosis of neurological conditions affecting the brain.
Was there any particular disease that you were mainly interested in? Or?
Well, towards the mid and end of my career path, one of the key areas that I was interested in was in neuro-oncology. So in other words, imaging of brain tumours, whether those be primary tumours that arise in the brain itself or metastatic disease that goes to the brain from cancers in other parts of the body. But coming full circle to what we talked about earlier, Parkinson's disease is one of those fascinating diseases which unfortunately we still don't have a cure for. It unfortunately affects not an insignificant number of people as they get older. It's a movement disorder and it can be very disabling. And there are medical treatments. It's fascinating how medicine again has almost come full circle, because before many of the drugs for Parkinson's disease were developed, one of the ways of treating some of the symptoms was to actually make lesions or destroy certain cells within the brain in order to alleviate some of the symptoms. And this all went out of vogue when pharmacological treatments became available. But it then soon became apparent that those pharmaceutical interventions also had their own side effects. And suddenly people then started looking at the, in inverted commas, lesioning of the areas of the brain to treat the Parkinsonian symptoms. Of course, actually making a physical damage into the brain is very permanent. But then we developed techniques techniques of deep brain stimulators were developed. So you put electrodes very specifically into very targeted parts of the brain. And by modulating current through those electrodes, you can modulate the way that bit of the brain works. And this comes all the way back to what I did and the group that I was working with in my BSc in intercalated neuroanatomy, in that we were looking at the physiology of these groups. And you asked me which little part of the brain was I involved in. A bit of the brain that I was involved in is something called the subthalamus, which is one of the targets that we actually use in deep brain stimulator work. And indeed, I was honoured to work in Sheffield with a number of very clever neurosurgeons. And I have to mention Jeremy Rowe in particular, who was very skilled at looking at the selection of patients for deep brain stimulator. And I always used to help him in the planning of the positioning of these electrodes using the neuroanatomical imaging that we generated. And we developed techniques to try and show these areas in the brain in best possible detail.
Whenever you're saying obviously about your experience in medicine, it all you seem so confident that it's sometimes easy to forget the first steps in or during your degree and first steps as a doctor. When you look back, what kind of student were you? Were you always that kind of person that just grasped everything easily, or have you ever doubted yourself? Because obviously a lot of our students, it's quite normal to question your skills, question your abilities, since it's a very difficult degree. Just to get into medicine, I think and
not just medicine. I mean, I feel like I have doubts. You probably have doubts, Marta.
Time.
So it's quite a human thing, I think, to many extent. Yeah.
Yes, I agree entirely. I think as a student, I probably was a bit boring, actually. Or certainly in the earlier years, I was quite studious. In retrospect, I could have let my hair down a little bit more. I'm not saying I didn't let my hair down, but
not as much.
Not as much. But I think also it was quite difficult in those first few years. You always have doubts. Certain topics came easier than others, but I did find that things like anatomy generally, I had a grasp of anatomy. And I think this comes back to something Marta and we were talking about just earlier, and that I have a very visual memory. I have a very pictorial memory. I don't have so much of a linguistic memory.
You say that, but we've established already you taught yourself Polish, so I think it's
rather badly.
Honestly.
Work in progress. But no, for example, I remember during one of the exams for anatomy, it would say, describe the anatomy of the shoulder. So you could write an essay, or, as I did, I would draw a diagram, an illustrated diagram. So I would have very much more of as I say, pictorial memory, which also I think is one of the reasons why radiology, which is very much a visual specialty, suited me to the ground. I'm sure there are lots of people that would come through medical student training, and I think maybe it's changed a little bit now, but certainly when I was a medical student, we had very little formal exposure to radiology, which is a pity because it is a great specialty. And I think people underestimate how important perhaps radiology within medicine as a whole is, not just neuroradiology, but radiology as a whole, and in all kinds of aspects, in vascular imaging, in abdominal imaging, in chest imaging, and musculoskeletal imaging. It is radiology is a key aspect to much of what is now current medical practice.
Absolutely.
I think we can always argue that, this area is super important. I think with all scientists, I will always consider that my area of research is super important. You will say, obviously, immunology.
I wouldn't even just say for me. I remember very early on in my life. So my dad is actually a doctor. He's a clinician. He's an anesthetist. And my mom spent her whole life telling me how medicine is a great career to be in. But the questions I always asked my dad was well, you do this thing, but there's this machine attached to this person, right? Where's this coming from? Or where does that, so that element of it always really fascinated me, that it's not just one person who is sort of given this treatment. It's a team of people that involves people with very diverse skill sets, and they're equally as important members of this team.
I agree, and I think it's so important to recognise that imaging is very much a team effort. Sometimes there's a little bit of confusion in the terminology in the general public. I mean, there are the two terms, radiologists and radiographers, and I think these often get confused, even at seemingly very educated levels.
I'm glad you mentioned this because I was going to ask about it.
Radiographers are the very skilled, well-trained technicians who, again, do university degrees, who actually generate the images. They sit at the console of the MRI scanner, they control the MRI machine, they actually get the images. I don't sit at an MRI console. There were times when I wanted to, and I used to sit next to the radiographers, and it's important we can each learn from each other. Radiologists, on the other hand, are the medically qualified doctors who interpret the images. But the radiographers are much more than that. You know, most of the radiographers spend all of their day looking at images as they come off the scanner. And therefore they develop skills of their own. And they're very good, obviously, at spotting abnormalities as well. And sometimes, you know, they may spot something, dare I say it, that we as a radiologist don't spot. And, you know, they're obviously involved also in the direct patient contact. So when the patient comes for a scan, it's the radiographer that welcomes them to the CT or MR suite. They tell them about the procedure. They go through all the safety protocols because, again, I'm sure as you're aware, an MRI scanner involves a very strong magnetic field. And whilst there's no known biological hazard, you need to make sure that there aren't any reasons why the patient can't have a scan. And some people may have metal implants, etc., that would preclude them from having an MRI scan. So again, many of the safety aspects are taken care of by the radiographers. And then just to put in the word for all the other members of the team, there are also the nursing staff who are there within the department. They will ensure the patient journey is good for the patient. And then in the background, there are the MR physicists, work very closely with MR physicists who basically are the typically PhD qualified physicists who have gone into MRI. As part of my training, had to learn a little bit of MRI physics, but, you know, I don't have a PhD in quantum mechanics. A lot of these PhD physicists do have PhDs in quantum mechanics, and to understand to really understand the physics of MRI and to push the development of MRI to improve imaging and to develop new techniques, such as, for example, functional MRI. We may touch on that later. These techniques that we cannot do ourselves without the help of the physicists. So yeah, absolutely, it's a big team to get there. And we as radiologists, you know, we fulfill a very important aspect of that. But without the radiographers, without the nurses, without the MR physicists, we wouldn't have the images to interpret in the first place.
I love the analogy you made, not the analogy, but I guess the connection you made, particularly with the sort of radiologist or radiographer, sorry, I should say, I'm getting them mixed up now. The radiographer who can sometimes even spot things that, you know, you may have missed. Because we see this as well in our
community
field of research, where we've got technicians who sometimes are amazing people who do such amazing work. And because they've got so much experience and exposure to these equipment. So we've got a technician in our department who, like, I go to her for advice about stuff that I've spent decades doing, you know, and sometimes she would tell me things and I'm like, oh, that was stupid of me to think that I would know that better than her. It's like teamwork is just in every field. It's just such an important.
I mean, what one example was something that it's widespread now, I think, throughout many departments, in fact, all departments probably, but there were some key members of the radiography team that pushed this forward really very early on, probably whilst I was still a trainee, so maybe 30 plus years ago. And back in the day, you would, for example, have somebody who came into the A&E department and they'd have a skull x-ray for a fracture, head injury. Of course, nowadays it would probably be straight to the CT scanner. And I remember one very, very senior radiographer spotting a fracture on a skull x-ray. But because he was only a radiographer, didn't feel it was his place to mention this to the very junior doctor who was looking at it in the A&E department, who missed the fracture. And there were inevitable consequences of that. So they developed this thing called a red spot. And so if a radiographer who has maybe spent 10 years looking at X-rays, has seen thousands upon thousands of skull X-rays, more so than the junior doctors, if they spotted something that was abnormal, just in the corner, they'd put a little red spot, a little sticky red spot, so that the doctor looking at the scan or looking at the X-ray would know that an experienced radiographer felt that there was an abnormality. They wouldn't necessarily have to say what the abnormality was. If the doctor had any common sense, they'd then go back to the radiographer and say, actually, I can't see anything, but what did you think it was? And then they'd have a communication. So I think it's important to recognise that there are some extremely skilled people who, maybe they don't have a medical degree, maybe they're not officially able to generate a clinical report, although that's changing as well. I mean, there are now highly trained radiographers who are doing reports. At the end of the day, it still has to be officially signed off by a radiologist through some form of protocol arrangement.
I guess that's more like a legal responsibility thing rather than So I think that's also good to say that like careers have changed a lot. Like they're not so defined in their own paths now. They're becoming more and more
and they
diverse.
keep changing.
Yeah.
So they will probably be different in 10 years from now in terms of what we can actually do. But following on your medical degree, so you've completed your medical training, and what was your first job? Did you go straight into neuroimaging or?
Oh, no. So when you leave medical school, you have to do what now are called foundation years. But when I was a junior doctor, were called house jobs. And you have to do surgery, medicine, and sometimes other specialties as well. And then in order to get into training in radiology, you needed to get a little bit more experience. So I actually did medicine. I did a medical rotation in Liverpool, actually. And I got my membership of the Royal College of Physicians as part of that training, which again, whilst it wasn't strictly speaking an entry requirement, by default it almost was, to either have Fellow of the Royal College of Surgeons or member of the Royal College of Physicians to enter into radiology training. That's less of an issue now. A lot of people do come into radiology straight off from foundation years. And in some ways, actually, I think it's very good to have done a little bit of general medicine on the wards, seeing patients before you come into radiology, because radiology, again, it is a clinical specialty. We are clinical radiologists. I'm a clinical neuroradiologist, and I can't hesitate in emphasizing that. So it's important to have that medical knowledge and that medical background to understand the pathologies, the disease processes.
So is there a specific training pathway into radiology now?
Oh yeah. So you have to join a defined radiology training scheme, of which Sheffield is one of the top training schemes in the UK. And indeed, that's one of the reasons why I came to Sheffield in the first place. I was training in Manchester at medical school, did my house jobs in Manchester. You often do. You tend to stick in the city where you trained at university. But then, as I say, I moved to Liverpool because there was a good medical rotation there. And it was a random conversation, in fact, with not a radiologist. It was actually a neurologist who we were talking about what careers we were looking to doing. And I'd mentioned radiology, and she said, oh yeah, there are, some really good training centres. There's the Hammersmith in London, there's Oxford, Cambridge, and Manchester and Sheffield. And at that time, all of the training schemes advertised individually. Nowadays, the Royal College of Radiologists run a national recruitment scheme, but each of the schemes advertised independently. Sheffield had a few jobs available, so I applied and fortunately got one of the posts. And even though I had lived in Manchester for, pretty much all of my life at that stage, as I now know, wonderful city just on the other side of the Pennines, was an enigma to me. I knew it existed, but I knew nothing of Sheffield, other than some random conversation I'd had in the back office of a ward on the renal transplant unit with somebody who probably didn't know an awful lot more than I did myself, who just happened to say Sheffield's a good place to do radiology. So
it's good to see that not a lot has changed in those years, because I feel like Mancunians still ignore Sheffield quite a lot.
Yeah, they do, but let's keep Sheffield a well-kept secret.
Yes.
Yes, that's important. So many years later, here you are being a lecturer at University of Sheffield in a teaching hospital. Wow, that's a long journey from obviously like being a medical student, and later on when we spoken obviously before, like we haven't spoken about it yet in this podcast, you've had loads of clinical experience, but also on the side of your clinical experience, you were involved in research, you were involved in supervising PhD students and writing papers, and also you have contribution to book chapters on the topic. How did it all happen? How did you manage to fit everything within your career? Because it sounds like a lot.
Yeah, so the first paper that I got published, which actually probably is one I still think of as one of the best papers, was actually related to the research that I did in the neuroanatomy lab with Professor Crossman. And this was published in the Journal of the Journal of Anatomy. And that really summarised all of the research that I'd been doing in the lab. But then inevitably, as you're wanting to get into radiology and as you're wanting to develop your career in radiology, it's quite important to try and do little bits of research, audit, etc. And again, one of the first papers I wrote actually was about some interesting little additional bones within the foot.
The opposite end of the body.
Absolutely. But again,
where are we now? We were in the head, and right now we are in the foot.
Yeah, but these were called the accessory ossicles of the foot. So they're little sesamoid bones that sit in tendons around the foot. A bit like the patella. The patella is a big sesamoid bone. It's not the only one you have. You've got other little sesamoid bones in tendons, and there are quite a few around the foot. And I just happened to be reporting and came across one of these and spoke to the consultant about it, and she said, "Oh yeah, you see these occasionally. Why don't you write it up?" So we did, and then I got more involved specifically with the neuroradiology. In terms of the book chapters, I'd been invited by some of the co-workers when I was training in Manchester. So again, I came full circle. So just to dot the I's and cross the T's. So I came over to Sheffield to do radiology training, and that was basic radiology. Everything from chest x-rays to barium enemas to ultrasounds, etc., etc. And at that time, whilst I knew I had the interest in neuroanatomy, I probably didn't declare my interest in neuroradiology until a little bit later. At that time, however, there wasn't a specific training programme for neuroradiology in Sheffield. So I had to look around the country. I applied for one job in London, which I didn't get at Queen Square. But then the next job that came up was, lo and behold, back in Manchester. So I went back to the very same hospital that I did my house jobs. In fact, even working with some of the neurologists that I'd worked with previously as a house officer, and also some of the consultants who were neuroradiologists at the time. So I did my training there. And it was largely through those contacts and training consultants in Manchester that suggested I start to do some of the European courses in neuroradiology. And I think a lot of countries in the sort of early 1990s were already starting to develop good training schemes in neuroradiology. And there was, at that time, an established but still relatively much in its infancy course in neuroradiology, the European course in neuroradiology. And I was fortunate enough to go along to that on a few occasions. The first one was in Maastricht in the Netherlands. The second cycle was in Prague in the Czech Republic. And then latterly, the third cycle was in Sweden. And it did a number of things for me. First of all, it introduced me to some fascinating key names in neuroradiology in Europe, very senior figures, some of whom I eventually came to know in more detail at a personal level. But I was in awe of these lecturers at the time. But what it did do is it introduced me to another good friend, a chap called Federico Resta from Milan, and Romanowski Resta. We were put together in alphabetical order in the same group.
Just sitting next to each other.
We were sitting next to each other in the tutorials, and Federico and I got chatting. And again, this is another aspect of these courses. It's not just about the education. It's about the networking. It's about meeting people. Maybe there was a tendency for some of the groups to stay in their national groups. You know, the Swedes would all sit together. The Italians would all sit together. The Spaniards would all sit together. But Federico and I got on very well together, and we kept in touch. And then a few years, probably 2 years after I'd finished the course, Federico had been asked by his boss in Milan to give a lecture in Poland. And anyhow, Federico, similar age to myself, his wife was about to have a baby. They were moving apartment. He said, "Sorry, I can't go, but there's this half Polish guy I know from Sheffield who might be interested." And suddenly I receive an invitation from one of the most, if not the most senior professor of neuroradiology in Poland to come and give a lecture in Poland. This was at the Polish Society of Magnetic Resonance Imaging in 1996 in Kraków. That's how I got to know Polish neuroradiologists.
That's the link with Poland, which we'll
Big
touch
serendipity.
upon.
Yeah, serendipity. Absolutely. Had Federico had a different name, surname, or we hadn't been in the same group, had we not bothered to chat with each other. And again, it's so easy to sometimes sit in silence.
Absolutely.
And, I must say I'm still in touch with Federico. We communicate with emails occasionally, and I was at a course just before the COVID pandemic in Milan, and Federico and I met up, and we actually went out with an old friend for dinner, mutual friend in Milan. So
good to keep contact. So obviously you mentioned about Federico, and you mentioned before about the collaboration. What would you tell our students? Because obviously I know that a lot of people think that medicine or science overall, sitting, studying, you do your own research, but would you emphasize the importance perhaps of collaborations or actually going out speaking to people? And do you think that in your perhaps case, it was a lot also about who you knew and where you've been at the right time?
Absolutely. I think you can't underplay the importance of, dare I say it, networking. I think I was very fortunate. I mean, if I hadn't have met Federico, I wouldn't have been introduced to Jerzy Walecki, who was a professor in Warsaw. I wouldn't have had my academic connections to Poland. And it was through my academic connections to Poland that I then got involved with the European teaching overall. I then got invited, having been a delegate on the European course in neuroradiology back in the 1990s, I think from 2007, 2008 onwards, I then became one of the teachers, one of the faculty members of that European course. But it was through people I'd met in Poland, other European, very, very skilled teachers, many of whom were from either Italy or Belgium, who picked up, fortunately, I clearly have some skills as being a teacher. I enjoy lecturing. I think I'm enthusiastic about it.
We can tell.
I think that's also important.
I think it's a really underappreciated thing these days.
Yeah, the way I also think about it is it is a little bit of a performance art. There are some people who are extremely knowledgeable, but their skills at lecturing, it's partly knowing the audience, but it's also, I think, knowing how to get a message over. And I think one advantage also of lecturing in Europe is obviously all of my lectures, whether I gave them in Poland or in other places within Europe, they're all given in the international scientific language, which of course is English. And I have the advantage of being a native English speaker. Many of the other lecturers on these courses, very good English speakers, but it's not their first language. But what it did teach me is how to get that information over in a particular way to an audience, which is again largely a European audience, i.e. English is not their first language. Now, radiology, of course, is a wonderful specialty to be able to lecture in that particular forum because it's all down to the images. And you've always heard the expression that picture speaks 1,000 words. So I was very lucky in the specialty that is my specialty, and that it lent itself beautifully to being able to present. But I could also temper the way I gave my lectures in such a way as to get the key points over to the...
I think you are downplaying your abilities as a lecturer, because I have sat in an anatomy lecture, which you would also class as a very visual lecture, for full 2 hours where not a single picture was present anywhere. So people can do beautiful things so you're clearly very skilled, and that's why you could get that across.
I just genuinely believe, like, whatever we do, but if we do it with a passion and we know the message we want to give to people, people will sense it. If you are passionate or if you're not, you can present the most boring, because for many medical, and not even medical, but, biology students, like, anatomy is usually the boring one, and you very rarely hear people actually enjoying learning anatomy. But it's how you put this message across is important. And I think that's something that you must have mastered if people listened and they were really enjoying it.
Well, absolutely. And I think that's one of the things I do have. I have a great passion for neuroradiology, and I have a great passion for teaching that. And I think that comes over. And clearly I was doing it right, because they kept on inviting me back.
Yeah, so that's often a good sign.
Yes.
So you think that the message to our students, if they were thinking about, like, career in lecturing, anatomy, radiology, for instance, is just simply, like, just be passionate about what you're doing? Were there any other tricks, like, you could suggest them, or?
I think there are 3 words that I would use that I think are important for any career journey. Passion, definitely. So to have a passion for your subject, that is so important.
Agree.
The other thing is commitment. You do need to be committed, and sometimes that does mean sacrifices as well. But the other thing is you need support. And I have to say, my wife, Sarah, has been the absolute backbone of everything that I've done. She's been behind me, supporting me. She is also a doctor. She's a successful GP. She was a GP trainer, so also training GPs coming through the necessary rotation. She knew that obviously my career path did mean having to make certain changes to our lifestyle and to where we lived. As I've already mentioned, we moved from Manchester to Sheffield, back to Manchester. And we had no idea at the time, when I was doing my training in neuroradiology in Manchester, where the consultant posts would come up. Now, fortunately, a consultant post did come up in Sheffield at the right time.
You made the hop back over again.
So we hopped back over.
From one side of Big District to the other side of Big District.
Absolutely. Yeah. It's interesting, actually. There are a number of other consultant colleagues here in Sheffield who have trained in Sheffield. They've actually got consultant posts somewhere else in the country. But as soon as a consultant post then becomes available in Sheffield, they've moved back. So Sheffield is a bit of a magnet. And I know we touched on this briefly earlier, but it is a great unkept, it's a great little secret, and we need to keep it like that. But I think Sheffield is a wonderful city, and it attracts a lot of people, and it certainly has hits above its weight, so to speak.
I definitely discovered this as well when I came over, similar to your journey. I came from Manchester to Sheffield as well. And for me, again, it was a very unkept secret. Like, I would go to conferences and you would see some presentations from Sheffield, but I feel like it never gave the impression of the amount of stuff that was happening here.
Yeah.
And when I arrived here, I was just blown away by, everything that was happening, not just in research and science and teaching and medicine, all of it. It was just wonderful.
Because you still live in
You have to cross the Pennines every day to come over here.
Yes.
A lot of people do that, like commute and so on. So what about supervising a PhD students? Like, obviously, you've mentioned that you supervised quite a few PhD students. Has it ever been Have you ever thought of actually switching into research yourself, or your passion's always been with teaching and clinical?
I think my particular passion has been in clinical and teaching. So it's a little bit much to say. I supervised PhD students. I was involved in a lot of the work that they were doing as part of their PhD as such, but I don't think I was actually officially a name. I wasn't a designated supervisor, but I was involved in
part of the supervisory team.
I mean, the other aspect is I don't actually have a PhD myself. I have lots of other qualifications.
I think it's just enough.
Including Fellow of the Royal College of Radiologists and Member of the Royal College of Physicians. And now I hasten to add an honorary member of the Medical Radiological Society of Poland. So that was, again, a great honour.
A lot of links to Poland, which we'll touch upon in a minute. But before we do that, I wanted to ask you, obviously, about you've done all these things and you've gone pretty much throughout the whole of your career. You've literally done it all. Even for our previous guest, he was literally at the very beginning of his medical journey.
Yeah.
You've done it all already. And for people like him, for people like our students that are thinking of applying into medicine and they don't have everything figured out, people are often not worried, but they are also thinking you have so much responsibilities as a medical doctor. When does the family come? If for a student that doesn't have everything figured out yet, but knows that wants to go into the medicine, do you have any advice?
I think it's important to remember that medicine, whilst it's obviously an extremely responsible career, it is also still a job. And at the end of the day, the important things in your life are family, and to get that life-work balance. I know there are some people who do focus only on their medical career, sometimes perhaps at the expense of their family lives. And it can be difficult. As a trainee, you have to do lots of work, passing exams, and that does require lots of book reading, etc., putting in extra hours for tutorials outside of your working day. And I think, that is where the commitment to achieving your career goal really comes in. And I think it's, as I say, I've had Sarah is a wonderful wife and, she's supported me throughout that. But, there are no doubt, there are times it's been hard. But you do need that commitment. You do need that passion to carry on. It's not an easy journey, and inevitably, as usually happens, big exams coincide with babies and things like this. And, it just happens to be that's the time of your life when these things are happening. Moving house, having a baby, it always seems to...
Or as you have four kids,
yeah.
Which we met too, Hannah and David.
That's
Hannah,
right.
just briefly.
Yes.
And I think most of them also went into the same direction, medicine, science, PhDs.
Well, certainly science. So of the four children, there's only one who became a medical doctor, and he's doing anaesthetics, actually. That's David. But we have Anthony, who is a naval architect, which is basically an engineering degree, and he has a PhD.
So he designs ships.
He designs. That was his passion, and he again went into that, and then he did a PhD in real world modelling of real world wave dynamics and hull structure. So basically a hydrodynamics PhD. Although interestingly, he's moving away from that area now, but again, I think all that sort of mathematical, analytical approach is very much in use in his current career. And then our daughter Hannah, she did zoology as her first degree, and then did a PhD looking at the changes of climate on the diet of bats. So,
fascinating.
All scientists, and even Matthew, who's our eldest son, who currently is a chef, actually did a master's in engineering before becoming a chef.
What a change.
I think being a chef is quite a lot like being a scientist. Like, you're constantly measuring bits and bobs, mixing things together, and then coming up with these new creative ideas, which are, so.
And again, engineering, I think, is a great degree. It's a problem-solving degree. Right. So, and working in a kitchen certainly is involved with a lot of problem-solving.
Yeah. Obviously, we were mentioning before about your current lifestyle and the farm and all the interests. That's where I also think that Hannah got her interest in animals from. But we met basically for the house sitting. So on the side of all your responsibilities as a doctor, clinician, and oral lectures, you have a wonderful farm life, and it definitely takes up a lot of time. On the top of the farm, you do a lot of other things like painting, playing piano, learning Polish and particularly language. When do you find the time for that? And do you think that are these interests helping you as a doctor, or do you think that these things are helping you wind down? Are they helping you to become a better scientist?
Yeah, I think so. I think it's important to have life outside of medicine. And I think early on, I got a very good life-work balance. Yes, I was a consultant. Yes, I was committed. And obviously, not only is there commitment, there's responsibility as a doctor. And, when the phone rings, if you're on call, you get out of bed and you go into the hospital to look at an MRI scanner at 3:00 in the morning. That is life as a doctor. But you also need to be able to park that, and family life was important. I think Hannah was only 5 when we got our first dog, which was the first pet that we had at home. But that was great as well because, at the weekends it meant that it was a 3-line whip. Everybody went for a walk with the dog. The children were very much involved with that. Maybe they didn't do it independently, but, they were very happy to go out. And we all enjoyed similar hobbies. We enjoyed walking in the countryside. And again, this is another of those absolutely wonderful things about Sheffield. Yeah, it's a big industrial city, but it's a big industrial city with a great industrial history and heritage. But it's also a city right on the border of some of the most beautiful countryside in the UK, and the Peak District in particular, which we now are privileged to live in, is wonderful. So, we'd get out every weekend, we'd go walking, they'd enjoy the outdoor life with us. When Hannah got a little bit older, she had an interest in horse riding. Sarah used to have a horse when she was a teenager back at her home, used to do quite a lot of riding, but then hadn't ridden for many, many years. But then Hannah developed an interest, and suddenly we were loaning a horse, and suddenly one dog became 2 dogs.
And then 3.
3 was more latterly.
I can relate. One cat became 2 and then 3.
Well, we had 21 in the past because by accident. But so from one dog, how did it become a farm? And can you tell us a bit more about how a typical day on a farm looks like? Okay. Because, in fact, quite a few of my colleagues, when we are quite fed up with the research and like how difficult sometimes it can become, sometimes we just sit down and say, what about having a farm instead?
Me and my wife talk about this every day.
And I always say, well, I know one person that can tell you a little bit about that.
Okay, well, we've already heard the word commitment in terms of medicine. Well, you have to have commitment in terms of having a farm. I mean, I must stress, we are not farmers. We do not have a commercial farm. You would really describe ours as a small holding, but we have animals, and with animals come responsibilities. And so we've perhaps just for the benefit of the podcast, we up until recently had 2 horses. One of them sadly died a couple of weeks ago, which was a hard decision for us to make. But then again, clearly that was something that needed to be done in the best interest of the animal who was suffering. We have 4 donkeys, we have 2 goats, we have 3 dogs, and then we have a whole collection of ducks and chickens.
And an owl recently.
And an owl,
oh,
yeah.
Wow.
Well, not a pet owl, but...
that would be impressive.
No, we were very delighted to see that a little... probably even 2 tawny owl chicks had been born in one of the nest boxes we have up in the trees just by the farm. So what is a day? What does a day involve? Well, it clearly focuses very much on the responsibility that you have to the animals. So, we'll get up early, we'll feed the dogs, let the chickens out. That doesn't mean, we can't make a cup of tea and maybe take it back to bed and have a little relaxing time before getting up to do the other things. Other things then include dealing with the bigger animals, the horses and the donkeys, feeding them, grooming, picking out the hooves. In fact, we had the farrier up to look at the hooves today of the donkeys. And that probably takes a couple of hours in the morning and skipping all the fields, making sure they're all clear. And then obviously walking the dogs. They're quite big dogs. They need exercise. And we're in the process at the moment of training the 2 younger dogs who are still very much puppies and perhaps not quite as well trained as they ought to be at the moment. And then, come the evening, we're back to feeding again, feeding the dogs, feeding the horses. And then at night, because obviously we don't want predators getting the ducks or the chickens, we have to make sure that they're all tucked away in bed. So, the day starts at 7 o'clock in the morning or even sometimes earlier. And, now that it's not getting dark until late, last night I think I was putting the chickens and ducks to bed at 10 o'clock. So, there is a, 365 day a year commitment, which is how we got to know each other, how we came in, because if we want to go away on holiday, we can't leave the farm unattended. We need somebody to house sit and to look after the animals. And that's how I got.
That's why I'm desperate to finish the PhD so I can spend more time on Charles' farm. It was
brilliant.
We did it only for a week and it was such a big entertainment for us. And I remember that it was the time that I just had so many things in my mind and I was really, really stressed. But Charles and Sarah, they just welcomed us with open arms. Like, they were just so lovely and understanding, obviously. And after a few days on the farm, yes, I was ill, but at the same time, just being with these animals made me so relaxed. Like, the problems have just gone away. I remember I was spending hours with goats. I don't know, for some reason, goats were just, I think, I can't tell my favorite because, like, all of them are absolutely favorite, but they are just such a loving animals. But you just can stroke them for all day and you just don't remember about anything else.
Wow.
Which, I'm just desperate to come back, obviously, without the PhD.
And we're desperate to welcome you back. I mean, you did a brilliant job.
I may turn up during the weekend to see the owl.
I actually want to ask a question. It's kind of on the theme of the podcast. So we often talk about journeys. So journeys of careers, journeys of, So I'm guessing this farm was also a journey. How did you actually end up with this collection?
Okay, so I moved back to Sheffield in 1995 as a consultant, and that happened to be the year that Hannah was born as well. Hannah, our youngest daughter. And so the first stage of my career was very much establishing myself as a consultant and developing those skills. And then other things came along like the teaching, the European teaching, etc., etc. And the children obviously then got to an age where they were starting to move away to university. And Hannah, I think, was still very much living at home at the time, coming up to her A-levels, and we knew that she would be moving away. And we were very privileged to have a lovely house in Sheffield. It was quite a large house. And we knew that when Hannah eventually left, we'd be sort of rattling around a little bit. And we'd spoken, not very seriously, but we'd spoken about moving out into the countryside, possibly when we retired, which I have to say would have been the wrong time to do it. And just randomly, we were looking, for farmhouses for sale, in inverted commas, in Derbyshire, and this one came up, and initially we thought, oh no, it's not going to be suitable. But we walked, we made an appointment, went to have a look at it, and it's funny how life-changing decisions are made with minimal information. So we went to have a look around this farm, which at the time was a working farm. It was a pedigree cattle farm. The farmer was retiring for health reasons. And it clearly was being sold as something to develop rather than a working farm. And we spent maybe 45 minutes walking around, looking at the views, looking at the potential, because it was very much a working farm and very much in a sort of ramshackle state in places. And as Sarah and I walked up the drive, we looked at each other and said, we have to buy this. We have to buy this. And, so it happened to be a listed building in the Peak District National Park. So to do anything in terms of renovation required lots of permissions, and the journey to simply go from putting in an offer to actually completing on the purchase took 13 months.
Wow.
Whilst we got all the necessary permissions from the Peak District authorities, etc., etc. And that was before the work even started. And so at the time, we had 2 dogs, and we had the horse Blue, and he was in stables in Sheffield. We stayed in our house in Sheffield for a little while before moving out to the farm, but we lived on the farm initially in a caravan for a few months over a very, very cold winter.
That is commitment. I can see the commitment already.
And, it was a quagmire of mud as you walked from the caravan to where we'd parked the cars. And then eventually we moved to the luxurious accommodation in the garage. So we lived in the garage for 18 months.
Wow.
Which actually was lovely. At least we had a proper toilet and shower as opposed to the caravan toilet and shower.
Yeah.
And then eventually the things were moved on, but it just a little bit. It definitely was, again, a passion. It needed commitment, and it also needed a vision, which I think is another thing that we possibly touched upon, whether you have a vision for your career. We had a vision. We saw in those 45 minutes that we spent at the farm initially, we knew this had potential, but it also meant it would be a long journey. So from start to finish, all the renovation work probably took about 3 years to get to where we are now. And it's still ongoing. There's still the ongoing.
It probably never finishes.
It'll never finish, no.
Yeah.
If only filling the holes in the lawn where the dogs are digging up, or the puppies are digging up, I should say.
Sounds wonderful. I need to come and see this farm.
You do, absolutely. You're very welcome.
It is the most stress relieving place. In all honesty, I absolutely love that. Love like all the animals, all the selection. Do you have any favorite animal?
Oh, it's impossible to say. I mean, they're all our favorites in many ways. I mean, the one thing I would say, possibly if you're to push me into a corner, is the one thing that dogs have is absolute unconditional love. No matter how rubbish a day you've had, no matter how bad you've been feeling, you come back through the door and there's a dog greeting you with a wagging tail. They are absolutely, brilliant, stress relieving. And, we some of the children have been through difficult times. They've had difficult journeys, they've all now got successful careers, but that's not to say that they haven't had their problems, and no doubt coming home, taking the dog up onto the moor, shouting, screaming on the moor, only in the company of the dog. They're great listeners, dogs, and great stress busters and therapeutic animals to be with. So I think
pet therapy.
Pet therapy, absolutely.
We have a couple of questions left. Just going back to your heritage, and obviously you've mentioned with a high passion that you are a member of Polish Radiology Society.
Yes.
Why Poland?
Well, as you know, I'm half Polish. My father was Polish. My mum was English. I was born and brought up in Manchester, but my father was one of 7 children, and I have lots of cousins over in Poland. Sadly, most of his siblings, with the exception of one aunt, have now passed away. But we used to travel to Poland as a child, and there are 2 cousins in particular who are the same age as myself, and I have a wonderful relationship with those cousins. I'm in great now with things like WhatsApp. We can do WhatsApp video calls very easily, but for many years it was just a telephone call. But we'd stayed in contact, and what's great is that their children are of similar age to our children, and all of that group get together well. And so I have the family roots, but in addition to that, I have my academic family. So I met this Professor Jerzy Walecki, in 1996. And through his contacts, I got to know other Polish neuroradiologists and really built up a great set of colleagues and friends. And it was through going to Poland, giving lectures to the Polish audience, but also I'd had a number of Polish doctors come to visit my department here in Sheffield. And there was a lovely lady called Romana Bogusławska, who again is a very senior neuroradiologist in Poland, came over. A couple of other people came over more recently. A doctor called Jagoda Jacków-Nowicka came over, and she spent time with me in my department. And again, it's through these contacts that a few years ago I was given the very, very great honour of being made an honorary member of the Polish Medical Society of Radiology.
I guess it means a lot to you personally as well, if obviously you're half Polish. But what is, I think, impressive as well is that you obviously learned Polish, you taught yourself Polish, and for perhaps those that would like to learn it, not that there are probably many people, because we all know that it's relatively difficult. How did you find it? Did you have any suggestion, like recommendations for people that like to learn a foreign language like that, for instance?
Well, I think you need to immerse yourself in it. Obviously, I had the motivation because of the Polish heritage. And again, most of my cousins whom I spent quite a lot of time with, the great thing about university is that you get, certainly in the first few years, you get nice big long summer holidays. So in 1980 and I think it was 82 and 83, I spent 2 or 3 months in Poland during the summer holidays. And at that point, none of my cousins spoke any English. So the only way we could communicate was in Polish. And I think also we were of the same age, so we had similar passions that we wanted to talk about. It was an interesting time politically in Poland. It was the birth of solidarity and then martial law and things like this. So there were many great political changes afoot. And, I was in my sort of early 20s, late teens, early 20s. So there was lots of discovering oneself and sharing that journey with my cousins. The two cousins in particular, Renata and Dorota, we'd sit up in their bedroom until 3-4 o'clock in the morning chatting about the world, the universe and everything. And Polish. And Polish. In Polish. We did have a dictionary, and we'd occasionally have to dip into the dictionary.
Because obviously Google Translate wasn't a thing
Google
back
Translate,
then.
absolutely.
But it shows that it is possible even without all these technologies, because nowadays we have easy access to Google Translate, which even as you speak can translate to your desired language. So it's quite impressive, obviously, how you can learn a language without that, because we forgot actually about this ability that kids learn language by just simply immersing themselves. Okay, so final questions before we wrap up. What was the best ever career advice that you have received?
There are lots of bits of advice along the way, but I think one of them, actually, which I think was a game changer, was when I was a registrar, possibly early senior registrar in radiology here in Sheffield. I'd already decided that, or I'd already thought that neuroradiology was going to be the career for me. But many of my contemporaries were saying, oh, no, don't do that. There are no career opportunities. It's a small specialty. You're waiting for people to retire. In the next 10 years, there are only a handful of jobs going to be coming available. It's either that or waiting for somebody to drop dead kind of thing. And I remember talking to Professor Anne Hemingway, who was the professor in radiology at the time, not a neuroradiologist, she was a vascular radiologist actually. And she said, forget what everybody else is telling you. If that's what you want to do, you do it.
That's the advice we could probably give to.
That's a profound message.
I mean, I think that's important. If you want to do something, do it.
I agree. I agree, absolutely. And this is something, the takeaway message, I think, from this podcast that we can leave for our students. Definitely very inspirational journey. And it's impossible to talk about everything, but I think we've covered quite a lot of information. So thank you, Charles, for all these insights, for sharing all your journey. Well, all your journey. I would say the chunk of the journey that we had the time to talk about. Because it was definitely very interesting. It's been an absolute pleasure
having you on.
But both of you, it's very kind of you to have invited me to open myself to you, and hopefully in the process people who listen to this podcast will pick up on some little gems.
I'm sure
definitely.
they will.
Okay,
thank you very much.
Thank you so much.
Okay, thank you.